And here we are back with article number 3 in the How to Analyze a Research Article for Critique number 2. So in this case, we have research article open access through BMC Cancer, and it is a single exercise session improves side effects of chemotherapy in women with breast cancer, an observational study. All right, so right in here, we're learning a few things about it from the title, but again, remember that titles are not necessarily what they actually did. So what we should do is try and read the article to figure out what they did. Also, sometimes the abstract is not 100% accurate. So although it can be used as a nice way to kind of like summarize, okay, here's what happened, it's not necessarily the best way to do it either. So let's see if we can find what it is. Okay, so here we go at the very end of the introduction section. The aim of this study was to measure changes in energy, stress, nausea, and pain immediately after a single session of aerobic or endurance training within the first week after chemotherapy. Okay, so, and then it says additional aims were to study if potential changes were related to the type of training, aerobic versus endurance, and to previous exercise habit, and if changes remained after 3 hours after training was completed. Okay, so in terms of the response variable seems to be 3 of them: energy, stress, nausea, and pain. I guess that's 4. So what is the relationship of exercise, a single session of exercise, on energy, stress, nausea, and pain? Now, how do you measure energy? How do you measure stress? How do you measure nausea? And how do you measure pain? Those are questions you're going to have to answer a little bit later on. And then, so that would be your response variables. There's 4 of them. And then the study factor in this case is a single session of aerobic or endurance training. Now, that in and of itself is a study factor. It's a thing that could affect those 4 concepts: energy, stress, nausea, and pain. And it's, did they do a single bout of exercise? But then they offered 2 different types of exercise. And if you look at the additional aim, is the type of training, does that make a difference? So there's a study factor of doing exercise, period. And then there's also a study factor of which kind of exercise, aerobic or endurance. Aerobic or endurance training. And then we also have an additional study factor, which is previous exercise habit. And then if the changes remained 3 hours after training. So you could say the time effect would also be a factor. So maybe you felt better immediately afterwards, or maybe you felt worse, who knows? But then did that effect last up to 3 hours after the exercise is concluded? And then it's in patients who have had chemotherapy. So within the first week after chemotherapy. So a cancer patient who has had chemotherapy within a week. So that'd be your population of interest. So now what we're going to do is we're going to look a little bit more detail at the population of interest. Okay, so under study setting and participants, we can see that this was conducted as an observational sub-study within the larger physical training and cancer study, PhysCan. So PhysCan was a randomized controlled multi-center trial that included patients with newly diagnosed breast, colorectal, or prostate cancer at 3 university hospitals in Sweden. So there was a bigger trial that was actually a clinical trial that did this. And then I'm also telling you a little bit more details about that they, in that study, they were assigned to high or low to moderate intensity exercise with or without supplementary behavior change techniques. And then the intervention included both endurance and resistance training for 6 months. And they give you a little bit of detail about how they did all that stuff, but that's not what we really care about. So what we really care about is that these people were from a larger study. And so they've got breast cancer, colorectal cancer, or prostate cancer. So one of the questions you have to immediately ask yourself is, are those 3 cancers representative of all cancers? Or maybe it's not. And the answer is, well, you have to make that decision. So then additionally, if we come down to the bottom here, participants for the present study were consecutively recruited from one site of the main study. So basically what they did is, out of the people who were eligible for, or who were participating in the main study, someone came up to them when they would come to their visit and say, hey, would you mind if we do an additional study on you? You're already doing it. Just answer some questions for us. So the eligibility requirements in this case here, eligibility requirements, inclusion criteria are breast cancer diagnosis, planned treatment with adjuvant or neoadjuvant chemotherapy, and training according to the PhysCan protocol. Eligible women received written information about the study. So in this case, they were only taking, in this particular study, they were only taking women who had breast cancer, who also had a planned chemotherapy, and we're doing the training protocol from the bigger thing. There's no exclusion criteria specific to this study. So if you really wanted to know what the full inclusion and exclusion criteria are, then you would have to come back up to this particular study, and you would have to look in their article where they reported on that particular study to know the full inclusion exclusion criteria. They also don't tell you really anything about how they were recruited. So what you can see is that they were consecutively recruited from one site of the study. So pretty much convenient sampling. So you're going to say that. And then the question is, how does this allow us to generalize to the bigger population as a whole? And the answer is you'll have to make that decision for yourself. But coming back up to the title of the article, they do specify breast cancer in that article title. So the population of interest is basically women who are doing breast cancer who have planned treatment for chemotherapy and are doing the training according to this particular protocol. Now, as far as the response variables, we see measurements here. Energy and stress were assessed via the Stress Energy Questionnaire during leisure time, which is SEQ-LT. So it's a modified version of the Stress Energy Questionnaire, the SEQ, which was developed to measure stress and energy at work. Now, the question is, are these women doing it at work? Let's keep reading. The psychometric properties of the SEQ-LT were found to be satisfactory in a population of workers in human service organizations by so-and-so. And then they tell you a little bit more about what it's like. Now, the question is, are these people who are doing it on, are they at work? Or are they just bopping around their ordinary daily lives, not at work? And they don't really specify that. So is this valid and reliable for the people that were using it in? And the answer is, I don't necessarily know. So you'll have to make that judgment call for yourself. Next, the nausea and pain intensity were assessed using the visual analog scale. So basically they used the visual analog scale from 0 to 10 centimeters, and they did one for each of them, one for nausea and one for pain. And they say the VAS is considered valid and reliable for measuring nausea and pain, and they cite some references there. And they say, in this case, they do specifically say populations with cancer. And then they did some socio-demographic background and other things. So your four main response variables, energy and stress, were measured with one particular measurement, the SEQ-LT, and that is going to be a summed scale. And then the nausea and pain intensity were assessed using the visual analog scale, which is a form of ordinal data. But it's an ordinal data that has been quantized. So you're going to end up with a number, which is the measurement of the distance that they drew their line or drew their dot. So now the next little bit that you're going to have to do is you're going to have to decide, is that a good way to measure each of those response variables? And then you're going to have to critique each of them in turn. Now, as far as the study factors go, remember that a factor is anything that could affect the study variable. So in their case, what they want to know is, did exercising affect those four response variables? And then they also want to know, is the type of exercise affect it? And how does time affect it versus 1 versus 3 hours later? And then they also wanted to know something else. Which one was it? They wanted to know how their previous exercise habit also affected things. So you've got basically four study factors, things that they are interested in knowing about that could affect those 4 response variables. Now, some other response variables that might affect things are the stage of cancer, the person's baseline fatigue level, they're all going to be female in this case, so gender is not going to be a problem. Age could be another one. And then they did include previous exercise. So that one is not going to be considered an extraneous factor because they're considering that an study factor in this case. So factors are anything that could affect the response variable, whether it's study or extraneous, depends on whether we're interested in it or not. I should note that one of the things you're supposed to look at is you're supposed to analyze the methods section. And here they give you a nice little diagram of how things are working. So, and they also describe what they did up here in procedures. So you're going to need to analyze how useful that data is and can you understand what was actually done during this study. All right, so now looking at the statistical analysis, what we can see is that they basically calculated the mean of each of the 6 items. So remember, they were a Likert scale, essentially on a scale of 0 to 5, and they basically took the mean of each of them. So they're treating ordinal data as numerical. And then also here, nausea and pain were reported with visual analog scale, and what they did was they recorded the number of centimeters. So again, they're taking ordinal data and they're treating it as numerical. And then they say differences in energy, stress, and nausea after a single training session were analyzed using paired sampled t-tests and presented as mean changes. So they did a t-test for every single one of the response variables from before and after the exercise. Now they set the significance level at 0.05. So P is less than 0.05 means that it is statistically significant for the purposes of the study. And they also calculated power with G power, and they decided they needed at least 34 individuals who could do both one session of endurance and one session of resistance training. So remember that in the larger clinical trial, they were supposed to be doing both endurance and aerobic training. And so in order to participate in the study here, they would have to complete one of each session. 34 would give us an 80% power. And they give you some nice little assumptions there. And then they said that they recruited 57 participants just in case there were dropouts. So overall, in terms of, power analysis and all that, things look pretty good there. Now, this is interesting. They say comparisons were made between mean values before and immediately after training and before and 3 hours after training. Since both SEQLT and VAS are ordinal scales, we also perform sensitivity analyses using Wilcoxon signed ranks test. So this is a non-parametric test that is specifically meant for ordinal data. And that is really nice to see that they're not just treating ordinal data as numerical data, which is what they described above. So that's nice. Then they also say that participants with positive and negative change were presented as number of individuals and percent and as a waterfall plot. So we'll have to look at that in a minute. And then also multiple linear regression was performed to analyze associations between the changes in energy or stress and the 3 following variables: previous exercise, training intensity, and energy stress level before training. So anytime you're dealing with multiple factors at once, controlling like that, you're pretty much going to have to use some sort of regression. So that is expected. And then they said non-significant variables were removed and the model was refitted only with blah, 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 blah. So eventually what they tried to do was get rid of factors that didn't make a difference and only include the factors that did. So overall, that's a pretty nice little statistical design there. All right, now when we get to the actual results, here you've got a nice table that shows some demographical and clinical statistics of the participants. So you've got age, habitual exerciser, and you can see yes versus no. And you can see in the study sample how they did. Education level, clinical stage of cancer, their treatment, what kind of treatment they were receiving, and then their before training baseline levels. So nice little table that shows all that stuff. And then they're going to have a results section for each of these parts. And so you need to basically just summarize. Again, summarize. So notice they're doing confidence intervals, 95%, and they're going all these ones. You do not need to report all of these, but you do need to report at least a couple of the main important ones. All right, now one thing that I really want to bring out here in this particular critique is that if you notice, up in the very beginning, they talk about aerobic versus endurance. So endurance, actually here they say endurance and then they say resistance in the abstract. Then in the introduction, they say aerobic versus endurance. So those things are very different. Which one is it? Usually aerobic and endurance are usually considered the same thing, whereas resistance training is considered anaerobic. So when we get down to the results section, what you see is endurance training and then in resistance training. So what and then also in the tables, you've got endurance training and resistance training. So what I'm guessing that happened is that there was either a typo or there's some sort of error that was in the original manuscript in that introduction session that never got fixed. So that's one of the things that you have to pay attention to when you're researching these studies, because it says one thing in one place and then something else somewhere else. So anyway, there's a difference between resistance and aerobic training, as you probably know. All right, and these are your waterfall plots. So these show the people who completed the study, and some of them actually felt worse after the endurance training, and some of them felt better. And with resistance training, some of them felt worse and some of them felt better. So this is a graphical way of representing who felt better and who felt worse. And then what you can also see is that A is energy, B is stress, C is nausea, and D is... So anyway, you can read that on your own time. But what you can see is how it's represented, and that's kind of nice in this kind of a study. They also show you the things here. So energy, and they show you before, after, and then 3 hours after. And then they show you the mean difference from before and after. And then they tell you the p-value, so you can see whether it is significant or not. And they're also using effect size, which is Cohen's D. And again, that's a nice way of showing, was this a significant difference clinically, or maybe it was statistical, but not clinically significant. And again, interpreting Cohen D's is actually out of the scope of this particular course at this time. So that is it for this particular article. Again, let me know if you have any questions, and I'll talk to you later.